Have you ever wondered what acid-base disorders are and how they affect the human body? Acid-base disorders, in the simplest terms, are conditions that occur when our body, in its infinite wisdom, can't quite keep its acid and base levels in equilibrium. It's a delicate balancing act, really. Our bodies are constantly working to maintain a steady pH level, the measure of how acidic or alkaline something is. But sometimes things can get a little out of whack. When our body's usual mechanisms falter, we can end up with too much acid, making our system overly acidic, or too much base, pushing us into an excessively alkaline state. The result? Acid-base disorders. They're not something you'd wish on anyone, but they're also a fascinating glimpse into the intricate workings of our bodies. Understanding acid-base disorders can provide valuable insights into how our body works in maintaining balance. To comprehend acid-base disorders, you first need to grasp the concepts of acidity and alkalinity. Let's delve into this world of pH levels and their implications. The pH scale, ranging from 0 to 14, is our guide here. A pH level of 7 is considered neutral, like pure water. Anything below 7 tilts towards acidity, while anything above leans towards alkalinity or basicity. An acidic solution has a high concentration of hydrogen ions, while an alkaline solution is teeming with hydroxide ions. These ions are not rogue elements. They actively participate in many biological processes, playing a vital role in maintaining the body's pH level, which ideally hovers around 7.4. Now, how does the body maintain this pH balance? The answer lies in the bicarbonate buffer system. Bicarbonate, a base, and carbon dioxide, an acid, work together in this system to keep our bodily fluids from becoming too acidic or too alkaline. When there's an excess of hydrogen ions, bicarbonate swoops in, neutralizing the acidity. On the other hand, when there are too many hydroxide ions, carbon dioxide steps up, increasing the acidity. This dynamic duo of bicarbonate and carbon dioxide constantly dance to the rhythm of the body's needs. However, it's not always a smooth waltz. Sometimes, due to illness or other factors, the balance can be disrupted, leading to acid-base disorders. Consider the bicarbonate buffer system as a seesaw. When everything is in balance, the seesaw is level. But when either bicarbonate or carbon dioxide outweighs the other, the seesaw tilts, indicating an acid-base disorder. For instance, an overproduction of bicarbonate might suggest metabolic alkalosis, while an excess of carbon dioxide could hint at respiratory acidosis. So, the body's balance between acidity and alkalinity is crucial for our health. It's a delicate dance of ions and buffers, a seesaw of chemical reactions that keep us functioning. As we delve deeper into acid-base disorders, remember this balance and the role it plays in our well-being. Now that we know what acidity and alkalinity mean, let's discuss the types of acid-base disorders. First on our list is metabolic acidosis. This occurs when the body produces too much acid or when the kidneys aren't removing enough acid from the body. Causes can range from severe dehydration, to kidney disease, to diabetes. Symptoms can include rapid breathing, confusion, fatigue, and even shock in severe cases. Next up, we have metabolic alkalosis. This is when your body has too many bases, or alkali. This can be due to excessive vomiting, which causes a loss of hydrochloric acid with the stomach content, or overuse of diuretics or antacids. The symptoms are often subtle, and can include muscle twitching, hand tremors, and lightheadedness. Moving on to respiratory acidosis. This happens when your lungs can't remove all the carbon dioxide your body produces, causing body fluids to become too acidic. This can be caused by chronic airway conditions like asthma, severe obesity, or sedative misuse. Symptoms can include fatigue, shortness of breath, and confusion. Finally, we have respiratory alkalosis. This occurs when you breathe out too much carbon dioxide, upsetting the body's acid-base balance and making your blood more alkaline. This can be caused by hyperventilation from anxiety, fever, or high altitude. Symptoms can range from lightheadedness, to rapid heart rate, to loss of consciousness in severe cases. Now you might be wondering, why are these disorders important? Well, our bodies function best at a certain pH level, and maintaining this balance is crucial for our body's cells to work correctly. When these levels are too high or too low, it can cause the symptoms we discussed earlier, which, in severe cases, can be life-threatening. It's important to realize that these 4 disorders are not exhaustive of all acid-base disorders, but they are the most common ones. There are also mixed disorders, where you can have more than one acid-base disorder at the same time. For example, someone with severe asthma might have both respiratory acidosis from retaining carbon dioxide and metabolic acidosis from lactic acid buildup. It's also worth noting that while these disorders might seem distinct and separate, they often interplay in complex ways. For example, the body might compensate for metabolic acidosis by increasing respiration to remove more carbon dioxide and increase the pH, which can then lead to respiratory alkalosis. So, it's not always as simple as just one disorder, but understanding these 4 basic types is a crucial first step in understanding acid-base balance in the body. These disorders, though different in their causes and effects, all result from the imbalance in the body's pH level. How do medical professionals diagnose these acid-base disorders? Well, let's dive right into it. The primary tool for diagnosing acid-base disorders is a test called an arterial blood gas, or ABG for short. This test, which is usually performed in a hospital or a laboratory, measures the levels of certain gases in the blood. But how exactly does this work? Think of the blood as a superhighway, carrying essential elements throughout the body. Among these are acids and bases, the balance of which is vital for our well-being. An ABG test gives us a peek into this busy highway, allowing us to measure the levels of oxygen and carbon dioxide, the 2 main gases that affect the body's acid-base balance. By measuring these gases, an ABG test helps determine the pH of the blood. If you recall from our previous discussion, pH is a measure of how acidic or basic a solution is. In the body, a normal pH range is between 7.35 and 7.45. Any deviation from this range can signal an acid-base disorder, but an ABG test doesn't stop there. It also measures the partial pressure of oxygen, often termed as PaO2, and carbon dioxide, known as PaCO2, in the blood. These readings can provide further information about the body's oxygenation and ventilation status, which can also impact the acid-base balance. Beyond the gases, an ABG test also considers bicarbonate levels. Bicarbonate is a base that helps neutralize excess acid in the body. If bicarbonate levels are too high or too low, it can indicate an acid-base disorder. In essence, an ABG test provides a comprehensive snapshot of the body's acid-base balance. It's like a detective, sifting through clues to detect any disruptions in the body's harmony. And it's not just about identifying the disorder, but also about understanding its severity and cause, which are crucial for formulating an effective treatment plan. A correct diagnosis is vital for effective treatment and management of acid-base disorders. It's a complex process, but with tools like the ABG test, medical professionals can ensure that our body's acid-base balance remains just right. So, how are acid-base disorders treated? Now that we've delved into the nature and diagnosis of these conditions, let's turn our attention to the treatment strategies. The first step in treating acid-base disorders is to address the root cause. Like detectives, healthcare providers investigate the patient's medical history, symptoms, and diagnostic test results to identify the underlying issue. This could be anything from kidney disease to a lung condition, a metabolic issue, or even a dietary habit. Once the root cause is identified, it can be treated appropriately, and this often leads to the resolution of the acid-base imbalance. Now, let's talk about more specific treatment measures. One of the primary methods of treatment for acid-base disorders is the use of intravenous fluids. These fluids can help correct imbalances by either increasing the body's acidity or alkalinity, depending on what's needed. For example, for metabolic acidosis, a condition where the body is too acidic, intravenous bicarbonate may be administered to help neutralize the acid. Medications can also play a significant role in treatment. Some acid-base disorders are caused by the body's inability to properly regulate acid or base levels. In these cases, medications can help by adjusting the body's acid-base balance. For instance, patients with respiratory acidosis, which is often due to chronic lung conditions, may be given bronchodilators to improve their breathing and thus, their body's ability to regulate acidity. In severe cases, when acidosis or alkalosis has become life-threatening, dialysis may be required. Dialysis is a treatment that filters and purifies the blood using a machine. This can help restore the body's acid-base balance when the kidneys are unable to do so effectively. But treatment isn't just about medical interventions. Lifestyle changes are also a crucial part of managing acid-base disorders. For example, a diet low in sodium and high in fruits and vegetables can help prevent metabolic acidosis. Regular exercise can also help the body maintain a healthy acid-base balance. It's worth noting that these treatments are not one-size-fits-all. Each patient's treatment plan will be tailored to their specific needs, taking into account their overall health, the severity of their condition, and their personal lifestyle. And remember, the goal of treatment isn't just to correct the numbers on a lab report, it's to restore the body's balance, improve the patient's quality of life, and mitigate any uncomfortable or dangerous symptoms. This is a journey, and like any journey, it requires patience, persistence, and a good deal of teamwork between the patient and their healthcare provider. In conclusion, treating acid-base disorders is a multifaceted process that involves addressing the underlying cause, administering appropriate medications or therapies, and encouraging beneficial lifestyle changes. Treatment aims to restore the body's balance and mitigate symptoms. And with the right approach, it's a goal that is entirely achievable. Can we prevent acid-base disorders? That's a question that's probably on your mind. While there is no surefire way to prevent all acid-base disorders, there are certainly steps we can take to reduce the risk and manage these conditions effectively. First and foremost, maintaining a healthy lifestyle is crucial. This isn't just about preventing acid-base disorders, it's about overall well-being. A balanced diet brimming with fruits, vegetables, lean proteins, and whole grains can work wonders. These foods not only provide essential nutrients but also help maintain the body's natural pH balance. It's like giving your body the right tools to function optimally. Regular physical exercise is another important aspect. It keeps your muscles strong, promotes cardiovascular health, and helps your body eliminate waste more efficiently. But remember, moderation is key. Overdoing it can lead to problems like lactic acid buildup, which can tip the balance of your body's pH levels. Now, it's important to mention that some causes of acid-base disorders are unavoidable. Certain diseases and conditions can disrupt the body's acid-base balance. In such cases, the focus shifts from prevention to management. This could involve medication, lifestyle changes, or even surgical procedures in some instances. It's about working with your healthcare team to find the best way to manage your condition and maintain as healthy a life as possible. Also, regular checkups and screenings play a vital role in early detection and prevention. They give you a chance to catch potential issues early and address them before they become major problems. In the end, prevention and management of acid-base disorders hinge on understanding them. That's why it's so important to keep learning, stay informed, and take an active role in your health. It's not always easy, but it's definitely worth it. Remember, understanding acid-base disorders is the first step to prevention and management. Stay healthy and keep learning.